Today we're going over a suction machine made by MedQuip. Right here's your on-off switch. To turn it on, you just simply turn it over like that. Right here's your suction gauge. The object of this is to clear any airway, to clear your respiratory airway. Turn it on is here. If you ever think for whatever reason it's not sucking like it's supposed to, you want to put your finger over the hole and see if your gauge goes up. If your gauge does not go up when you do that, you have a problem with your suction machine and you need to get to your provider. If it does go up, then you probably have a different problem. It's probably going to be your filter. On this filter in particular that it comes with, on there, on one side it says in, on the other side it says out. That's the way that air needs to flow. So it needs to flow in, out, because it's sucking towards the machine. So the next place you would check it would be here. If it pulls your finger in and the gauge goes up, then it's working fine. That's not your problem. Your replacement filter should look something like this, and it doesn't matter which way it goes, unlike the filter that comes with the machine. The next thing that goes on is your canister. You're supposed to clean this after each use with mild soap and water. After you're done cleaning it, you could put a little bit of mouthwash in there to keep it clean and sterile. Next place you would check it would be here. Now it's going to take a little bit longer to go through because it's having to pull through more air. But once again, I have to pull your finger in and the gauge should go up. If it does not suck good there, you either don't have this piece on the canister, or your lid's not on your canister good, or you have a crack or hole in your canister. The next thing that goes on is your tubing. Your tubing should look something like this. Now this is your regular suction tubing, and this is your filter tubing. There's a difference. If you're sucking an airway, you want to start at the machine and work your way back to the catheter. Power cord goes in right here. And you can tell it's plugged in by these two lights here. And it's going to suck better when it's plugged in and charging. Your suction machine is also going to work better when it's brand new. So the older it gets, it's just not going to suck as good. And also if it's not plugged in and it has an internal battery, then it's not going to suck as good. The next thing you're going to have is a car charger. Now this has a fuse inside, so I only want you to use this while you're sucking because it could blow your fuse, or it could also overcharge your battery and ruin your suction machine. The last thing on the bottom of this is a filter. Check it every 2 or 3 months. You'll see it'll get dusty. You can just knock the dust off of it. If you have to, you can replace it. If you don't have a replacement, call your provider. They can mail you one. Also, when you get your suction machine, go over the owner's manual. Thank you. Have a great day.